My dear paramedical students, Volkmann's ischemic contracture, a very commonly asked university exam question. It is named after Richard von Volkmann, and this is the year of his life. And this is the person. He has discovered many things, including the Volkmann's retractor. The condition is also described as a non-infectious ischemic condition. Ischemic means lack of blood. So this is a picture, and the definition you people must write. It is a permanent flexion contracture of the hand at the wrist. So the wrist is over here, there is a flexion and it is becoming somewhat S-shaped. The elbow is in flexion, the forearm is in pronation, and the wrist is in flexion. 5 P's we must memorize: pain, pulselessness, pallor, paralysis, paresthesia, lack of sensation. What is the pathogenesis? You people must definitely draw this diagram. There is a type 1 arterial injury to the blood vessel leads to ischemia, lack of blood, and there is a reduced capillary blood flow, and this will lead to ischemia. The second one is there is an injury leading to edema. The edema can lead to increased tension because of swelling. There can also be hemorrhage, and because of this there can be an ischemia. Therefore, a fasciotomy has to be done. The fascia has to be cut to release the tension and place the blood flow. Mainly, the radial artery volume is reduced. Please remember and draw this. The causes are all these things you people should memorize: neglected compartment syndrome, crush syndrome, fractures with vascular injury, bleeding disorders, improper use of tourniquet, improper use of plaster of Paris. And look at the contracture over here, the Volkmann's ischemic contracture. The most commonly affected muscles are flexor digitorum profundus, flexor pollicus longus, flexor digitorum superficialis, and pronator teres. Identify the muscles in this picture. It is a beautiful line diagram. I would like you people to memorize this particular list. And what is the prognosis and treatment? So, untreated ischemia will lead to necrosis. The muscle and the nerves are damaged in the involved compartment. The limb becomes deformed, as we had seen in the picture. There is a loss of sensation, and amputation might be needed. Otherwise, gangrene will be there. So what should be done? Early diagnosis. Fasciotomy means you are cutting the fascia, and removal of the unwanted devices such as plaster of Paris to avoid the Volkmann's ischemic contracture. All said and done, it is difficult to treat once it develops. Please write this university question.